Imagine you are in Game 7 of the World Series in your rookie season, down by 3, bases loaded, and you are in a 3-2 count. You load up, swing, and the ball leaves the ballpark. You are a World Series hero and Rookie of the Year for your amazing season. Move forward a few months later, and you are notified that you are permanently banned from Major League Baseball due to drug use. Drugs are something that professional sports organizations take seriously, whether it be something of a performance enhancing drug or drugs like marijuana. Athletes are deserving of a second chance and should not be permanently banned due to their first offense of drug use. First, we will discuss how many athletes do use drugs and alcohol due to the amount of stress they put on their bodies. Then, we will discuss that many athletes are prescribed addictive drugs when they are injured. And lastly, we will discuss how athletes are deserving of another chance. Many athletes engage in behaviors that are harmful to themselves and others and can negatively impact the way that they perform. It is not just drug use among athletes that is something that is very common. According to the NCAA, student athletes have higher rates of binge drinking compared to those students that do not participate in sports. A 2017 study had also found that those who engage in high contact sports, such as football, rugby, and soccer, are 1.8 times more likely to binge drink and smoke. Many student athletes use drugs and alcohol to help them with the amount of stress that they put on themselves under. Between having a job, going to school, and participating in a sport, they put themselves under a lot of stress. Amphetamines are common groups of drugs that athletes use to give them energy and balance a job, school, and a sport. According to Scholastic Prescription Stimulants 2011, these types of medications are in the same class as cocaine and meth, which increase alertness and energy. Athletes are prescribed many different types of medication to deal with the injuries that they may receive due to the sports that they participate in. There are a lot of addictive pain medicines that may be used to help athletes cope with the injuries that they sustain. According to Harvard Health, 97% of those that use opioids do not have an addiction problem. However, that leaves 3% of them that do. There are a couple of these pain-relieving drugs that are very addicting. One of these pain-relieving drugs is OxyContin, and it can become very addictive. According to WebMD, some of the side effects of this drug include nausea, dizziness, constipation, sweating. And another one of these addictive pain-relieving drugs is Vicodin. According to WebMD, the side effects include nausea, tiredness, dizziness, and drowsiness. These drugs can become very addictive and can lead to withdrawal if it is stopped suddenly. According to the American Addiction Center's 2022 article, How Long Do Opiates Stay in Your System? Opioids travel through the body very quickly. However, they may still show up on a drug test 1 to 3 hours later. Athletes deserve a chance to help them with their drug use rather than just getting banned the second that they have a negative drug test. There are a few different types of treatments that can be used to help stop addiction. According to Karina Underwood's 2020 WebMD article, the 6 treatments that have been found to be successful in treating addiction are detoxification, cognitive behavioral therapy, rational emotive behavioral therapy, contingency management, and 12-step facilitation, and also treatment with medication. The 3 most effective treatment options, in my opinion, are cognitive behavioral therapy, contingency management, and 12-step facilitation. According to Underwood, cognitive behavioral therapy is valuable because it can help treat other addictions such as food addiction and alcohol addiction. It can also help you develop coping skills. Also, according to Underwood, contingency management can also be used to treat a wide variety of different addictions. This type of therapy reinforces your positive behavior and gives you tangible awards for maintaining your sobriety. Also, in Underwood's 2020 WebMD article, 12-step facilitation programs can be used to treat both alcohol and substance abuse. One of the more popular 12-step facilitations program is Alcoholics Anonymous, which makes use of group meetings and social support. Should athletes serve a lifetime ban if they test positive for a drug test? I do not believe that they should serve a lifetime ban. There are a number of different factors that need to be taken into consideration before making a big move like banning someone on a career that they have worked so hard to reach. It is important to think about the amount of stress that student athletes put on themselves between school, job, and the sport that they participate in. It is also important to think about the different types of addictive medications that they may be receiving as treatment for their injuries that they may sustain. I also believe that it is important that these athletes have a chance to take care of their addiction as well. In my opinion, I do not believe that athletes should have to serve a lifetime ban unless it is something that even after therapy and other different types of ways to fight addiction if it keeps happening. We, as a community, need to make sure that we are supporting these athletes and understand the situation that they are in. Whether it is them being injured and being prescribed addictive drugs, or a student athlete who is trying to stay up all night between school, a job, and being an athlete. I believe that these major sports should start to offer more help for their athletes that are struggling with drug use, and schools who have student athletes should follow the same path as well. We need to make sure that we are offering these athletes the help that they deserve. Thank you.